Speaker, to the Minister of Health, I'm proposing legislation to better enable Ontario to deal with emerging infectious diseases, West Nile, Lyme, Ebola. There seems to be much work to be done on many fronts: diagnosis, treatment, prevention. Treatment of Lyme disease, for example, is fraught with conflicting medical, scientific, political, social dimensions, disputes that are long overdue for resolution. Social media has been accused of politicizing the issue, communicating inaccurate information, pitching dubious, sometimes expensive treatment. There's also allegations of shortcomings in the diagnosis and treatment of Lyme directed at mainstream medicine. Minister, we have government for a reason. Are there no adequate mechanisms in place to deal with some of these disputes?
Thank you, Mr. Speaker, and I appreciate the question. In fact, the opposite is true. There are many measures, policies, and procedures in place. In fact, the member opposite knows not only that this government and my ministry is committed to protecting the people of Ontario from vector-borne and zoonotic diseases, but we have effective policies and programs for all of the items that the member opposite mentioned: surveillance, prevention, control of zoonotic and vector-borne diseases, including promoting, importantly, the public awareness of these diseases, and also emergency preparedness. And I appreciate the timeliness of the private member's bill, because of the preparations that have been underway for quite some time in terms of Ebola preparedness. But you can appreciate, Mr. Speaker, being a public health specialist myself with significant expertise precisely in these areas, that I looked at these policies and procedures, and I look at them with great scrutiny, Mr. Speaker. I'm happy to continue in the supplementary.
Supplementary. Yeah, thank you, Minister. Over the past several months, I've developed legislation attempting to use a neutral, objective, science-based, research-based approach to emerging diseases like Ebola and Lyme. I am calling on your ministry to legislate a provincial framework, an action plan encompassing surveillance, educational materials, as well as guidelines for prevention, identification, diagnosis, treatment, and management, including emergency preparedness and sharing best practices. The private member's bill comes up this afternoon. It mandates research as well as collaboration, consultation with all concerned, and in particular with the public. Not many people know what's going on. They get information from websites and CNN, but there's a bit of a gap. So, Minister, there presently is no legislation requiring all of this. Are there any reasons why you would not support such an approach?
Thank you, Mr. Speaker, and I welcome the private member's bill. In fact, I'll be participating in the debate later this afternoon about it. I can't speak for my colleagues, but I will be supporting the bill this afternoon. And but I do want to say, just so there's no confusion or anxiety out there, Mr. Speaker, that part of the reason, largely the reason I can support it, is because everything that Bill 27 is proposing is already in place to protect the people of Ontario from vector-borne and zoonotic diseases. But I sincerely want to thank the member from Haldimand Norfolk for bringing this forward. I'm looking forward to the discussion and the debate, and quite frankly, we can always do more. So our government is very open to having discussions on how to continue to improve the surveillance and the prevention and control of our vector-borne and zoonotic diseases.
Thank you. New question, the member from Niagara Falls.